So if you were sitting, if a dentist was sitting next to you now and he asked what the key benefits of biomaterials were, what would you say to him then?
The elevator speech?
Absolutely.
Well, I would say that for the first time in my tenure in this industry, is we now have dental materials that actually interact with the tooth structure, not just in a chemical standpoint, but in a functional standpoint. So we're not just filling a space, but we're actually acting with the tooth for the best outcomes. So we're mimicking. Bioactivity is not the only word. You can use biofunctional, you can use biomimicry, you can use other words to say the same thing, but we're really trying to mimic what the tooth does now.
Okay.
And is.
Okay, and that benefit therefore is to the patient
better outcomes.
Okay.
Longer term outcomes. That's the hope.
Yeah.
Because see, the number one problem or number one reason for failure in let's say most dental restorations, whether it's a crown, a bridge, a dental sealant, a composite, or whatever, is leakage. And whether the leakage is coming from within the restoration or from outside of the restoration, opening up gaps and so on and so forth, the fact is we bonded to the tooth, but we didn't seal the tooth. We didn't seal the dentin. And so if we can keep the acidic nature and the bacterial nature that comes along with biofilm, if we can keep it out, but not try to attack it, in other words, let the oral environment stay in balance, but yet we can seal the tooth and not let those deleterious effects enter, then we're going to have better outcomes, because composites are not falling out. They're having decay underneath them. And so if we can stop that, then these composites can last longer. And that's exactly what we're aiming for, and I believe other companies are aiming for, just are in different positions of that development.